Hi, I'm Dr. Greg Gonzava. Today I'd like to talk a little bit about colon cancer and colon cancer screening. Every year in the United States, there's 150 new thousand cases of colorectal cancer, typically over the age of 50, although it can happen at any age. We typically start screening for colon cancer around 45 years old. Typically, colon cancer starts as a polyp in the colon and oftentimes can be asymptomatic, meaning a person doesn't even realize they have it. Some people have bleeding with bowel movement when they use the restroom, weight loss and pain. Any of those symptoms can be very suspicious for colon cancer. A lot of people don't have it, but if you're in the age where you should have a colonoscopy, it's very important that you consider having a colonoscopy to screen for colon cancer, especially if you have those symptoms and/or family history of colon cancer, unexplained weight loss, bleeding, or pain. To screen for colon cancer, there are a few different ways we can screen for it. The gold standard best way is a colonoscopy, which is just that it's an endoscopic tube passed through the rectum through the colon, looking for polyps, and/or it looks for other diseases too, like diverticulosis, diverticulitis. But the great thing about a colonoscopy is it's not just diagnostic; it can be therapeutic. Meaning, if a colon polyp is encountered, they can remove it through the colonoscopy. So therefore, it removes the polyp and the threat for colon cancer altogether. Some people cannot tolerate a colonoscopy for various reasons. Maybe they're paraplegic or quadriplegic or cannot tolerate the prep or things of that nature. There are other tests that are less invasive, like a DNA stool test, such as perhaps you've heard of Cologuard. And of course, there's oftentimes we use FOBT, fecal occult blood tests, which are usually given yearly. They're not quite as effective for screening for colon cancer, nor is Cologuard. Again, a colonoscopy is the gold standard. And it typically begins around age 45 or sooner if there's a family history of colon cancer or family polyposis. As mentioned, the general guidelines for colonoscopy is starting to screen for the average adult at 45 years as a starting point. We start younger than that, oftentimes 10 years younger for family history of colon cancer or polyps. However, colon cancer can start at any age. So as a physician, if a patient has worrisome symptoms such as unexplained rectal bleeding, particularly in the face of weight loss and abdominal pain, a patient should have a colonoscopy. So that would be before even the guidelines that we would follow.